Second, stenosis is characterized by a valve opening that is too small, making it difficult for blood to pass through the valve. And third, it's the atresia. Atresia is a condition where a heart valve has no opening at all, leading to a solid piece of tissue forming between the heart chambers that blocks the flow of blood. Next is peripheral arterial disease, or the PAD. PUD. It is in the legs or lower extremities in the narrowing or blockage of the vessels that carry blood from the heart to the legs. It is primarily caused by a buildup of fatty plaque in the arteries, which is called atherosclerosis. So it is an issue with the blood vessels of your arms, legs, or abdominal organs such as narrowing or blockage. Next disease, it's the aortic disease. Aortic disease, or the aortic valve disease, is a type of heart valve disease. In this condition, the valve between the lower left heart chamber and the body's main artery doesn't work properly. And the problem with the large vessel that directs blood from your heart to your brain and the rest of your body, such as dilatation or aneurysm. Next disease, or the coronary artery disease. So coronary artery disease is caused by a plaque build-up in the wall of arteries that supply blood to the heart, which is called the coronary arteries. So this plaque is made up of cholesterol deposits. So coronary artery disease, or CAD, is also called the atherosclerosis. So meaning it's a condition in where plaque builds up and hardens the arteries, causing a blockage in the heart's blood, affecting oxygen supply. Next is heart failure. Heart failure is also known as congestive heart failure. It is a condition that develops when your heart doesn't pump enough blood from your body's needs. This can happen if your heart can fill up with enough blood. It can also happen when your heart is too weak to pump properly. So in simple words, heart failure is a problem with the heart pumping, relaxing functions, leading to a fluid buildup and shortness of breath. And next is congenital heart disease. Congenital heart disease, also called a defect. It refers to one or more problems with the heart structure that are present at birth. These abnormalities occur when the heart or blood vessels don't form correctly in utero. So in simple words, congenital heart disease, it's a heart issue with you're born with, meaning inborn disease, which can affect different parts of your heart. Next is pericardial disease. Pericardial disease is a condition in which extra fluid collects between the heart and the pericardium. Pericardium, it is the sac around the heart. And the extra fluid causes pressure on the heart, and this keeps it from pumping blood normally. In simple words, pericardial disease is a problem with the lining of your heart, including pericarditis and pericardial effusion. And next, cerebrovascular disease. Cerebrovascular disease refers to a group of conditions that affect blood flow and the blood vessels in the brain. In simple words, cerebrovascular disease is an issue or a heart disease issue with the blood vessels that deliver blood to your brain, such as narrowing or blockages. Next, arrhythmia. Arrhythmia, or irregular heartbeat. It is a problem with the rate or rhythm of your heartbeat. Your heart may beat too quickly, too slowly, or with an irregular rhythm. It is normal for your heart rate to speed up during physical activity and to slow down while resting or sleeping. In simple words, arrhythmia is the heart's electrical conjunction system is causing a problem, causing abnormal heart rhythms or slow heartbeats, causing uneven or fast heartbeat. Next, deep vein thrombosis, or the DVT. Deep vein thrombosis is a medical condition that occurs when a blood clot forms in a deep vein. These clots usually develop in a lower leg, thigh, or pelvis, but they can also occur in the arm. In simple words, deep vein thrombosis is a blockage in your veins vessels that brings blood back from your brain body to your heart. And the last disease, cardiomyopathy. Cardiomyopathy. So, cardiomyopathy is a disease that affects your myocardium. When we say myocardium, It's the heart muscle. So cardiomyopathy can make your heart stiffen, enlarge, or thicken and can cause scar tissue. As a result, your heart can pump blood effectively to the rest of your body. So it is the enlargement of the heart affecting the heart muscle, and this can lead to heart failure and abnormal heart rhythms. And those mentioned diseases can be treated. So we have here the treatment. Treatment plans can vary depending on your symptoms and the type of cardiovascular disease you have. Cardiovascular diseases treatment may include the lifestyle changes, medications, procedures or surgeries, cardiac rehabilitation, or active surveillance. And lifestyle changes is an example include changing your diet, increasing your aerobic activity, and quitting smoking or tobacco products, and this includes the vaping. And when we treat medication, your healthcare provider may prescribe medications to help manage cardiovascular disease. Medication type will depend on what kind of cardiovascular disease you have. Procedures or surgeries. If medications aren't enough, your healthcare provider may use certain procedures or surgeries to treat your cardiovascular disease. Cardiac rehabilitation. You may need a monitored exercise program to help your heart get stronger. And lastly, the active surveillance. You may need careful monitoring over time without medications or procedures or surgery.
Promoting heart health. Heart health is fundamental to overall well-being and longevity. Maintaining a healthy heart is essential for reducing the risk of cardiovascular diseases, enhancing physical fitness, and promoting a high quality of life. By exploring the impact of heart health on individual vitality, we eliminate the path towards a healthier, more resilient future.
Cardiovascular disease is a leading cause of death worldwide, and lifestyle risk factors play a significant role in its development. Poor diet, lack of physical activity, smoking, excessive alcohol consumption, unhealthy weight, and stress are all factors that can increase the risk of developing cardiovascular problems. First is unhealthy diet. A diet high in saturated fats, cholesterol, and sodium can lead to the buildup of plaque in the arteries, increasing the risk of heart attack and stroke. Lack of physical activity can contribute to obesity and high blood pressure, both of which are major risk factors for cardiovascular disease. Second is not enough exercise. Being physically active is good for your heart and brain. People who are not active have double the risk of heart disease and stroke, as well as increased the risk of diabetes, cancer, and dementia. Being active helps your heart, brain, muscles, bones, and mood. Exercise is one of the most important things you can do for your health. No matter what your state of health, there is something you can do to stay active. Next is unhealthy weight. Being overweight can lead to high blood pressure, high cholesterol, diabetes, and sleep apnea. Obesity can double your chance of cardiovascular disease. Next is smoking or tobacco misuse. Smoking is one of the most significant lifestyle risk factors for heart disease, as it damages blood vessels and increases the risk of blood clots. Next is too much alcohol. Heavy drinking and binge drinking are risk factors for high blood pressure, heart disease, and stroke. Alcohol may also cause problems by interacting with your medications. Next is recreational drug use. Drugs such as amphetamines, cannabis or marijuana, cocaine, ecstasy or MDMA, heroin, opioids, LSD, and PCP can increase your risk of having stroke and developing cardiovascular disease. Last but not the least is stress. Chronic stress can have a negative impact on cardiovascular health by raising blood pressure and increasing inflammation in the body. By making healthy lifestyle choices, such as managing stress effectively, individuals can reduce their risk of developing a cardiovascular disease.
Cardiovascular disease is the leading cause of death worldwide, with risk factors including high blood pressure, high cholesterol, smoking, obesity, and lack of physical activity. However, there are steps that can be taken to prevent the development of this deadly condition. The first one is stop smoking. The use of tobacco products has been strongly linked to cardiovascular disease, mortality because of its adverse effects on cholesterol levels, blood pressures, and risk of clotting. The second one is weight loss. The restriction of caloric intake and saturated fat coupled with increased aerobic activity has been shown to result in maintaining a healthy weight. The third one is reduction of blood sugar. Reducing blood sugar levels can prevent the development of diabetes for some. Increasing exercise and lowering caloric intake can help the body increase sensitivity to insulin, which in turn reduces blood sugar. The fourth one is blood pressure. High blood pressure has clearly been linked to increased risk for heart attacks, stroke, and kidney disease. The prevalence of elevated blood pressure increases with age, but changes such as decreasing sodium intake can help for some. The fifth one is physical activity. Exercise can improve blood pressure, cholesterol, and blood sugar, all cardiovascular disease risk factors. Additionally, it can also lead to weight loss and improve quality of life. The last one is control cholesterol. High levels of cholesterol are associated with increased risk of the development of coronary disease. Avoid processed meats and foods high in sugar, and broil or baked food rather than fry. Taking proactive measures to maintain a healthy lifestyle can greatly reduce the risk of developing cardiovascular disease. By making smart choices regarding diet, exercise, and overall health habits, individuals can protect themselves from this deadly condition. Important facts. The heart pumps about 2,000 gallons of blood every day. Blood vessels in the body, if stretched end to end, would circle the earth more than twice. The heart beats around 100,000 times a day. Cardiovascular diseases are the leading cause of death globally. Regular exercise and a healthy diet can significantly reduce the risk of cardiovascular diseases. High blood pressure, high cholesterol, and smoking are major risk factors for cardiovascular diseases. Cardiovascular diseases can affect people of all ages, genders, and backgrounds. Early detection and treatment of cardiovascular diseases can improve outcomes and quality of time. Symptoms of cardiovascular diseases can vary but may include chest pain, shortness of breath, and fatigue. Lifestyle changes, medication, and medical procedure are common treatment for cardiovascular diseases.
In summary, exploring the cardiovascular system provides students with a comprehensive understanding of how the heart, blood vessels, and blood function together to sustain life. This knowledge not only deepens their grasp of human biology, but also fosters critical thinking skills as they analyze diseases and treatments related to the cardiovascular system. Ultimately, studying this vital system equips students with practical insights that can be applied to various aspects of health and medicine, enriching their academic and personal growth.
Next, we have here the function of cardiovascular system. The main function of cardiovascular system is to transport oxygen and nutrients to cells and remove waste products like carbon dioxide. It also helps regulate body temperature, maintain fluid balance, and support the immune system. In essence, the cardiovascular system is vital for keeping our bodies functioning properly by ensuring all our cells receives the oxygen and nutrients they need to thrive while efficiently removing waste products. The cardiovascular system also demonstrates how different parts of our body work together smoothly. It's like a well choreographed dance, ensuring everything runs smoothly in our body.